Mother and daughter are talking in the kitchen while preparing dinner. Daughter asks mother how she has been doing with her health and if she has seen her primary care provider. Mother answers that primary care provider had said something about her labs, but wasn't sure what he said. Daughter probes more and mother remembers that primary care provider said something about her diet and some new medications that were added to her medication list.
Mom, now we are alone. Where have you been? Have you been to a doctor appointment?
Yes, honey, I went the other day. The doctor gave me a new medication, which I do not remember, unfortunately, what it's for. And also, he mentioned something about a new diet.
Oh. Mom, I think we need to get the medication up and get another appointment to the doctor office just to know about what it means by your diet and what the medication is for.
Yes,
Do you want me to go with you?
Yes, you're right, Mary. First thing in the morning, I'm going to set up an appointment so I can get more information about the medication and also find out about that new diet that I'm supposed to be following. But no, honey, you don't need to go with me. Everything's going to be okay. I'll let you know what he says.
Mother and daughter are sitting down in the living room while talking about what she needs to find out from her primary care provider and what primary care provider wants her to do in regards to her diet, now that she needs to be careful with how and what she eats.
Mom, I don't want to happen this, but you need to know how important your taking your medication correctly is and how important your diet is for your long-term health.
I know, Mary, I know. It is just that sometimes it is so overwhelming with all the things that I have to do for myself and all the things that I have to remember.
Mom, it's understandable, but I think I'm sure at the office, at the doctor office, you can find somebody that can explain it to you at a simple manner, and yeah, and this way it's not going to overwhelm it for you.
I hope so. I hope so.
Yeah.
Mother is in primary care provider's office for follow-up visit. Primary care provider asks registered nurse to educate the patient in regards to her diet and medication.
Yes, come in.
Hello,
Hello, doctor.
how are you today?
Good, and you?
Yes, Shirley, what brings you in today?
Well, doctor, I went to pick up my medication at the pharmacy, and I brought them in today in order for you to review them with me. When I was here last time, I left a little confused in regards to how I'm supposed to take them. And you also mentioned something about my diet, what I need
Yes,
to
I
do for the
remember.
diet.
I remember. Okay, what I will do is I'll bring my registered nurse in so that she can explain. She's an educator, and she will explain to you further about the medication and the diet that you must follow. All right.
Okay, thank you
Any
so
other
much,
question?
doctor. No, that's it for
Okay,
now.
thank you very much. She's coming.
Okay, thank you. Yes, come in.
Hi, how
Hello,
are
good
you?
morning.
I am the nurse. My name is Luna. How are you today?
Very nice to meet you, Luna. Before you start, I brought in my daughter in order for her to sit and be present to hear all the information. Is that okay?
Yes,
Okay,
of
good.
course.
Thank you. Mary, come on in, please.
Hi. Good
Hi,
morning.
nice to meet you. Good
Nice to
morning.
meet you.
How can I help you?
Yes, my question is, I wanted to get some information about the diet that the doctor wanted me to follow because I've been eating the same all my life, so I didn't know what to do, and also what the medications were for.
Okay, let me see your medications. First one you have here is digoxin. It's for your heart, okay? You have to be careful with salt substitute because they have increased content of potassium, okay? The second one is warfarin, okay? You cannot eat a lot of green vegetable, okay, for these medicines. And And the last one is estatin. You can be careful. You can not eat, drink, or eat grapefruit with these medicines, okay? The other thing that I want to talk is about your diet, okay? Here I have my plate, okay?
I've heard about that.
In short, you have to eat a lot of fruit, vegetable, grains, okay? Non-dairy products is preferred. If you are going to choose between poultry or fish, you have to choose poultry or fish and not red meat, okay?
Okay.
By the way, I am going to give you a pamphlet and you take it at home and you read with more calm, okay?
Thank you very much, Nuna. That really helps me to understand my diet better and my health. My daughter and I will definitely go over the pamphlets, and if you have any questions, we will definitely call or come back.
Okay.
Thank you so much for your help.
Perfect. Have a good one.
Thank you.
Thank
You
you.
too. Thank you.
This educational video was made with the purpose to educate the older adults and their families with the importance of health literacy. When the patient has a low health literacy, it affects the client and the healthcare system overall. The elderly are most risk for this problem. Health literacy is a great indicator of the client's health, income, and educational level. An educated older client can save billions of dollars across the health care system. An educated consumer can have better outcomes and can adhere to medication therapies, better diet choices, and safer medication use.